And thank God that it's healthy living on Dove Television. My name is Oluwafemi Odunson. It's good to be alive and it's good to be here on this program. It's all about your health. That's why we always give information. That's why we always educate everyone listening to us, wherever you are, any part of the world. I want to say welcome. I have a special guest here with us in the house, but before I introduce my guest, I would like us to know that Dove Television is on all social networks. Like us on Facebook, Twitter. Does get to watch exciting and interesting program on our YouTube channel. And be part of Dove Television family. God bless you. We have Dr. Chris Williams in the house. Yes, he's one of our very doctors that we cherish a lot on healthy living. He's always here to tell us about the natural things we need to eat. And today happens to be a very important topic we'll be looking at. I want to say thank you so much, Dr. Chris Williams, for coming on this program.
Thank you.
While we want to proceed on this topic, we'd like Dr. Chris Williams, is also a pastor, to please lead us in a short prayer. Thank you.
Lord God, we are grateful for the gift of life. Thank you for the gift of today. We thank you for healthy living. We thank you for today's episode. We commit it into your hands. We receive your breath on it. And we ask that by it, you will further conquer sickness in the lives of your people.
Amen.
Thank you, Father.
Thank you, Lord.
In Jesus' name.
Amen. Please pay attention with us while we allow Dr. Chris Williams to please educate us and inform us on oxygen, while the oxygen is very important in the body and while the low oxygen in the body.
So
Though we have some pictures. While he'll be talking, we'll have some pictures that we would like to display for everyone to have a good understanding of what we are discussing here today.
Okay.
Low oxygen in the body.
So we are talking about low oxygen in the body. Usually you will ask why I chose the topic. That's because recently I met a woman, an elderly woman, who she is a retired nurse, and I like the way she approached me. And she said she's been coughing, and that she noticed that it's when she returns to her house that cough starts. That when she's away, because she goes around a lot to do omugo and all that, that cough is not there. So she said she thinks that it's because of where she lives. Her house is in an industrial environment and a lot of pollutions in the air. That's why I said this would be a good topic to talk about. What is low oxygen in the body? There's medically, there's a word used for it. It's called hypoxemia. And it refers to a situation where there is low oxygen consumption in the body, low oxygen in the arterial blood, in the blood. Okay, so it's called hypoxemia. And another word that can be used interchangeably with it is hypoxia. Hypoxia is insufficient intake of oxygen into the body. Now, what are the things that we see that can tell us that there's a situation of low oxygen in the body? Several, and many of them we overlook them. Something, for instance, like lethargy, tiredness, irritability, person is irritable, anxiety sometimes, inattentiveness, you lose concentration, you can't pay concentration, or you begin to forget things. Sometimes there's chronic inadequate oxygen in the person's body. Rapid breathing, fast breathing can also be a sign of low oxygen in the body. Sometimes it is headache. Other times it's cough. Other times it's a chest pain. That's pointing to the fact that the person has low oxygen in the body. The normal oxygen in the blood is between 70 to 100 millimeters mercury. Okay, 75 to 100 milliliters mercury, but sometimes it can drop to like 70, and then by the time it has dropped to like 60, that's really very dangerous, and by that time the person will start having some very severe symptoms. So there are several things that can cause it. However, we're still looking at the signs and symptoms. Sometimes a simpler way of knowing it is you all of a sudden you feel as if you need to breathe in more. You begin to feel choked. And then so you are making attempts to breathe in more and even deeper. That means you are in a situation of low oxygen in your body. Sometimes it's tightness or a tight sensation, yes,
Okay.
stiffness in the chest. It's also a pointer to low oxygen in the body. I've talked about confusion. I've talked about reduced concentration, forgetfulness, incoherence. And if it continues and it becomes unabated, it can lead to coma. It can lead to coma. Some other times, it's if you see the tips of my finger now, they are reddish. Sometimes when you see some people, the tips of their finger is bluish.
Okay, so there's an image that someone was showing us his finger nails,
Yes.
just an image. So let's just have that image. Please, my director over there, let's have the image of someone placing his finger on the table. Okay. Thank you. So please.
So sometimes it's a bluish tinge in the fingernails or even in the lips. Okay, that one of the lips can be more evident in babies. Okay, so these are different things to look out for that can point to the fact that there's low oxygen in the body. But if I wanted to generalize, whenever there's presence of a chronic disease, there is to some extent reduced oxygen present in the person's blood. Okay, so when there's a situation like diabetes, hypertension, there's reduced, because chronic sicknesses cannot thrive in the presence of adequate oxygen. Adequate oxygen and an alkaline environment, chronic sicknesses cannot thrive. Cancer is a situation that rides on the back of chronically low oxygen in the blood. All right, so these are the signs and symptoms. Now, the next thing will be, what are the causes? Several causes. Let's talk about environmental causes first and foremost. I talked about the woman and a retired nurse who she just came to a conclusion, and she was right, that the air she's breathing is not very oxygenated. In other words, it's full of pollutions, because she noticed that every time she's in that house, she'll begin to have issues with coughing and all that. So sometimes it's when you are living in a chronically polluted area, or for people who live in mountainous areas, when the altitude is too high. When you live at a high altitude, oxygen tends to be reduced there. Okay, or you live in a very densely populated, busy area, and there's plenty of pollution in the air, it can cause it. Other things that can cause low oxygen are things like bronchitis. Bronchitis is a type of chronic obstructive lung disease. Okay, bronchitis, lung cancer, pneumonia, is whether the acute type or the chronic type. An example of a chronic pneumonia is tuberculosis. Somebody who is battling tuberculosis will have low oxygen in the body. And as a matter of fact, it's one of the things that can tell us that somebody is having issues with their lungs, when you begin to see blueness of the fingertips, okay? And then there's also sleep apnea. The person, when some people
let's look
sleep,
at the image of the fingertip while you were talking.
Okay.
You cited an example, so we want viewers to have a clear understanding. This is a clear.
Oh, beautiful. Yes, that's it. So you can see how that person's fingers are blue. Okay, so this person is suffering something or the other that is leading to low oxygen in his blood.
Okay, yes. So now thank you so much. Yeah. So
that's that. Okay, so sleep. I was talking about sleep apnea. Some people, when they are sleeping, either they lie on the wrong side or something, their tongue, the back of their tongue, falls and covers the airway. It can lead to low oxygen in the body. They don't know, but at some point they will not be enjoying the sleep any longer. And it happens more in children. Sometimes some children can literally begin to turn blue while sleeping. especially in neonates or in premature babies. It happens. Okay, so epilepsy is also a situation that can create low oxygen in the blood, and because that's what happens when they have epileptic attacks. And they're having those crises, it can lead to hypoxia. They are no longer taking adequate air into their body, inadequate oxygen. It can lead to low oxygen in the blood, and before you know it, they begin to suffer brain damages.
Okay, let's have, I think we have some images, we have some pictures showing the low blood oxygen, low oxygen in the body. Can we just please have some of those things while doctor is talking to us?
Okay. Yeah. And then there are also medicines.
Sir, oxygen in the body.
Exactly. Okay, so oxygen in the blood, hemoglobin, iron-containing molecules found in RBC. Now, the things that move blood around, that move oxygen around in the blood are hemoglobins.
Wow.
So anything that leads to lowering of the hemoglobin or slowing of the hemoglobin or reduction of the hemoglobin will affect the oxygen circulation in the body.
Wow.
That's why anemia, for instance, it's a condition that can lead to low oxygen presence in the blood. Okay, anemia can do that. All right. So some other things that can do it are if there's a blood clot, for instance, and an aspect or the other of the body is not receiving enough oxygen because a blood clot is covering that. For instance, I saw the reason I remember this is because only a few days ago they asked to replenish the man's stock. I've shared his good report here before. When they brought him, he had been diagnosed of multiple infarcts in the brain. An infarct is a very small, an infarct happens when blood clots block some parts of the blood vessels in the brain.
Yeah, okay, so let's have an image of the brain right there, display on the screen, so that Dr. Chris can even give us a clear understanding of what we're discussing. Thank you. All right.
So, that's it. So, when one of the blood vessels that's carrying blood to any part of the brain gets blocked, blood cannot get to distal parts of that blood vessel. That's artery, and then that place will die, sort of, because
so
oxygen is not getting there. Yes. Oxygen is not getting there. You can see some areas that are not very red as other places. It shows that oxygen is not getting to those parts. So depending on the area in which it happens, it can lead to manifestations of brain disorder.
Wow, thank you.
So in this man, he had multiple infarcts. He had started forgetting things. I remember I shared this story here. He just woke up one morning, and his wife saw the way he was behaving. Said, "Daddy, what is happening?" He said, "I'm looking for the toilet." And they had lived in that house for over 20 years.
I pray you won't go and pee on the floor.
You know, and then after some time, the wife started observing him. He started looking for the fridge again, for the kitchen. So and was getting bad. He was forgetting many places. So and then after some being on treatment for some time, now the last time I heard, he was able to drive. Oh yes, he was able to drive. He had stopped driving. He had become even unable to go to church. He didn't know his way around. Okay, so all those things can happen also. So plaque formation in the arteries. Plaques are solids that block the arteries. Any part of the body where the artery is blocked, the artery cannot do its job of transporting blood to that part of the body.
Let's see some of these images that describe well what Dr. Chris Williams is saying.
That part of the body will start suffering low blood oxygen. So from people, it happens on their legs, on their feet or their ankles, and then their ankle begin to turn black.
This is someone's
lips. It begins to swell. Okay, this is somebody's lips also. You can see those cracks there. They are suffering one way or the other. the person's lips are suffering one way or the other. Okay, so there's ischemic conditions and all that. So several things can cause it. The question now will be, how does one manage it? The first thing is to be sensitive to the fact that when oxygen is low in your body, it can cause problems. There's oxygen in the air, abundant oxygen in the air, but if there's a gap, somehow you are not able to take it in adequately, or you take it in adequately and your hemoglobins, your blood is not able to transport it, your tissues will suffer hypoxia. They will suffer insufficient oxygen, and then your body begins to manifest. So how do you manage it? Number one, if you live in you find yourself or you live in an environment where there is low oxygen, you need to be sensitive to it. If it were possible, you need to change that environment. Either you live in a place of very high altitude, you need to come down to our level, okay? Or you live in a very polluted place like that woman, a place where pollutions are too plenty. You might need to change that place. You might need to change it, because that's the truth. You need to change it. Because if your body continues to be low in oxygen for a long time, it leads to all kinds of things. It leads to all manners of metabolic diseases. Okay, because the body is not able to defend itself. In an environment of alkalinity, an environment of adequate oxygenation, the body is able to heal itself.
Naturally.
But if those things are not there, or all the things that the body is grappling with the body will begin to suffer. Okay, so that's that. So better, you need to change your environment, and then better breathing practices. Many people have said it before, are not able to breathe well, or they don't know how to breathe. After some time, we lose the way we breathe. We become too sloppy in breathing, especially in the presence of things like obesity. If you have been around people who are really obese, when they are walking, you can see them, and then because they are just too sloppy, they are too big for their size. Okay, so better breathing practices at home. One of the ways you can just practice better breathing practices is you just sit as I'm seated now, and then you decide to breathe in and out. You can do it like 10 times at a stretch, and then you stop. After like 10 minutes, you can do it again. You can do it at office. It's breathing exercises. The more oxygen you take into your body, the healthier your body is. The healthier your body is. So better breathing practices. And then also, if you are smoking or you live in a smoke-rife environment, you need to deal with it. You need to take care of it. You need to change an environment that is polluted. Okay? And then there are foods that help to convey oxygen better in the body. There are foods. Water, for instance, the more you drink water, that's why we encourage people to drink water, especially alkalized water, at least 3 liters daily. The more oxygen is able to be transported in your body. Also, eating of dark leafy greens, ugu, all these vegetables. Thank God, in this part of the world, we are into a lot of vegetables. Broccoli, kale, ugu, whatever it is. When you eat more and more vegetables, because vegetables help help you to form hemoglobins a lot. And hemoglobins are the agents that help to move oxygen around your body. Drinking of lemon water also. You wake up in the morning, I'll suggest you do this maybe thrice a week, not daily. You drink lemon water, especially if it's a bit warm. You drink it, it helps. All these things contain a lot of antioxidants, and when your body has adequate antioxidants, you are able to fight. Your body is healthy for oxygenation. Other things is something like fish oil. There are different types of fish oil in the supermarkets and in the pharmacies. Okay, any fish oil, sometimes it's called krill oil, other times it's called shark oil. Any oil that is from fish, it's good for you. Blueberries also. Blueberries also help to improve antioxidation in the body. And then juicing. We talked a lot about juicing. Do you still do your juicing?
Yes, I do.
What about the blending?
I do most times. The blending, okay. I think I do more of the blending.
You know, there was that formula you gave us. You forgot it.
Okay. Now, please, let's remind our viewers again those formula.
Now, simple. Vegetables like carrot, beetroot, cucumber, cabbage, lettuce, avocado pear. Take any 2 or 3 of them, and then you blend them and you drink them. These things are wonderful. They are wonderful. When you blend, you have more of these antioxidants rushing around in your body. Sometimes I even use
the Ophio milk. Okay. I use it also. Okay. You know, after blending it, I sieve it and I pour part of the milk, blend with avocado pear, cucumber, and carrot. Oh my God, fantastic!
So what
I
do
like
you do with the chaff?
I throw it away.
Don't throw it away.
Oh, really?
You dry it, and when it's dry, you blend it.
Really?
Now you can add it to any food you are eating. As maybe if you want to make a bar, or you want to make a mala, or you want to make any of these meals, swallows that you make, add like 2 tablespoons.
Really?
That is fantastic fiber for your intestines.
So I will stop that henceforth.
So don't waste it. Blend it and then. Okay, so there are other herbs also that increase oxygenation in the body, like cayenne pepper, ginger, garlic. They increase oxygenation in the body. They increase oxygenation in the body. Also, there are other supplements like vitamin B's, generally B complex also helps. And then there's Life Drops.
Okay.
Life Drop contains liquid oxygen.
Okay.
Well, it's water that is, the oxygenation is increased, especially if you're sick and you need to get more and more oxygen into your body. I'll recommend Life Drops for you. And then as you are taking it, maybe you take like 15 drops under your tongue. You do it twice a day. It increases. We've had fantastic results with this. People just get on it, and then their symptoms begin to change rapidly. Because if you can get more oxygen into your body, sickness will reduce.
Wow.
Yes. The body will begin to heal itself. The body is a self-healing machine. It's not able to heal itself if it's not adequately supplied with what it needs. And the 2 things the body needs to go to work in healing is a good alkaline environment and a good oxygenized environment or oxygenated environment. I'm sure you have some questions.
Yes, I do have some questions, but I'm not going to take those questions now.
Okay.
We'd like to go on a quick break. When we come back, we have Dr. Chris Williams still here with us in the house. Please don't go away. We'll be right back. Thank you.
Welcome to the Open Heavens International Center. I believe that what you see and hear here will arouse your faith and your life will never remain the same. Challenge God using what you see here as a point of contact to your miracle.
Welcome back, still on Healthy Living on Dove Television, and I have Dr. Chris Williams in the house, always talking about the natural way to go. It's high time for everyone watching, wherever you are, any part of the world, to please pick up your phone and dial the number that will be displayed right there on your TV screen. But remember to mute it or reduce the volume so that we can hear you loud and clear. Still on the topic, that's the low oxygen in the body. We have some images that we would like us to revisit some of these images, and I would like my director over there to let people understand that this issue of oxygen is very important. We've shown quite some few, but there are others. That is a particular fruit, and I want Dr. Chris to explain what that fruit is. You know, you mentioned some things that we can take to build our oxygen,
yes.
and you said it's good to blend your carrots, your
cucumber,
yes,
cabbage,
lettuce,
beetroot,
avocado pear. These are the things that we
Yes.
see in the market every day.
Yes.
So we can go to the market and they're just
And we
on
said
low prices.
it's better to blend them and drink them
Okay.
than to eat them. Because when you eat them, you absorb only 25%.
Okay.
When you blend and drink, 75% is what you absorb. Yes.
So in blending them, it's okay. All right, before we have those images displayed, we have a call. Hello? We lost that call. Please, let's just have some of these images so that viewers can have a clear understanding of what we're discussing here today on Healthy Living. Thank you. Hello?
Hello?
Yes, you're on to Healthy Living. All right, we lost that call. All right, just to refresh the minds of our viewers.
Anything that you do to increase the alkalinity of your body.
Okay, this is just the one.
Yes.
The circulatory system carries two types of blood.
Yeah.
Okay.
Oxygen-rich blood, blood traveling into the body cells, high oxygen content, low carbon dioxide content. And then on the other side, blood traveling away from the body cells. That's when blood is being taken away from because as the blood comes towards the tissues, it comes bearing a lot of oxygen. So the oxygen is imparted to the tissues, and then by the time it's returning in the venous circulation, it contains less oxygen. Okay, so what happens sometimes is okay. So that's a picture of the hemoglobin. You can see that the indentation there, and then you can see some very red. And then you can see it very red. Some are not as red as the others. Those red ones have oxygen in them.
Oh, okay.
The ones that are not as red have little oxygen. Okay, if we see blood in the venous, if we see the hemoglobins in the venous return, we'll see them more blue because they do not have oxygen.
Okay, so the two images that I'll show earlier on, the red and the blue. So the red is the rich blood.
Yes.
That it shows that
carrying blood towards
the blue one is
the
low.
one that has been depleted and is returning away from the tissue.
Father, help us. Hello, you're on to Healthy Living.
Hello.
Yes, thank you for calling. Please go ahead, ma.
Good morning. I am Ernest Tobini. I'm a guy.
Oh, Ernest. You have a wonderful voice.
Very wonderful.
Thank you, Ernest. So please go ahead.
Yes, there's a program going on TV. Is it live?
Yes, it is live.
Okay, I would have loved to ask a particular question. There was something that they were saying about you blend something and mix together. So I wanted to confirm what is all about.
Okay, the things to blend.
Yes.
So we are saying that you get vegetables and then you blend them and drink them at least a liter daily. Examples of vegetables: cucumber, cabbage, carrots, lettuce, spinach, broccoli, ugu. You blend at least 1 liter and drink them daily. It has been a lifesaver for so many persons around the world. Oh, yes.
All right. Thank you, Ernest. God bless you for that. Hello?
Hello?
Yes. All right. Always mute or reduce the volume on your TV set, please, while speaking to us on this program. Thank you. Hello? Thank you so much. Please, you can also send in an SMS. We encourage all your text messages. We can also read them out to indicate where this text message is coming from. Thank you so much. All right. Why is it that in most cases the real... Okay. This is just another one. Any treatment for cysts on the kidney through all the fruits mentioned?
Yes,
Okay.
yes, you can. There are certain herbs and supplements, actually, that can help to the kidney to resolve that cyst. Okay, if you're on them, it will help you. There's, I'm trying to remember the name now, but the brand name is called a Stonebreaker. It's very good for the kidney. And then there's another one. There are like five things. For instance, something like Grapola, something like Gina. These help to ensure better blood flow to the kidney. And once blood flow is improved towards the kidney, it will be able to resolve that cyst.
Okay.
It will be able to resolve it.
All right, thank
Yes.
you. Which source of water is alkaline?
Alkaline water, you have to alkalize water before it's alkaline. Okay, so you get things with which you can alkalize it with. There are different things in the market: alkaline flax, alkaline rod, and all that. There's alkaline drops. Okay, so unless you get a particular brand, which we are not permitted to mention here now, that is alkaline, but very mildly alkaline, but that can also serve.
Okay, I try to make room for air at the night, but always come down with catarrh, cold. What do I do because the room is stuffy?
It's important your room is very well aerated. So what you should do is maybe you should start with cleaning it out and removing baggages from that room. The way you describe that room, I think, is too congested. Look at the things you no longer use and dispose them. So that there can be space. When there's space, there will be circulation of air. There will be good ventilation. All right? And then before you know it, when you open your window, you will not be sneezing. That sneezing is because there's plenty of dust in that room. Okay, but when the place is clear and the air is blowing and circulating, you will not be sniffing in dust.
All right. Hello, Dr. Chris. So I can't stay under the fan or AC for 5 minutes without feeling cold. Each time I feel cold, I start breathing fast. My heartbeat changed totally.
Wow.
Please, doctor, I want to know the cause. Thanks.
Well,
God bless you.
Anything can be
Peace
the
from
cause of
Lagos.
that. It might be you are nursing some kind of infection or malaria in your body. That can be the cause. You can also be a sufferer, and that's on the way to developing something like asthma or some other things. So this person should see a doctor. Let them examine you. They need to put the stethoscope on your chest and see what is going on there.
In the body.
Yes.
All right. Hello, doctor. I'm very interested in this program because some few months now, this person has been feeling serious pain at the left side by the head down to the neck, which he went for x-ray, but nothing indicates in it. James, what can I do?
Well, if you need to do more tests. If they did x-ray and they didn't find anything, then the doctor should tell you what is going on. They should be able to do that. If they cannot now find anything, that will be another case. I like for cases to be diagnosed so that we'll know what we are dealing with.
Okay, so I think maybe the person that's sending text can call doctor.
Okay.
Dr. Chris Williams will have his number displayed right there. Get to call him for further information. How can I control epilepsy in a child of 18-year-old that has cerebral palsy?
Wow, palsy. Well, seizures can be controlled. That the child can be without seizures. You change their diet, like we have been saying a lot here. You remove things that acidify that boy's body, and then you place them on the vegetables we talked about, and then you use specific herbs that help to alleviate crisis of epilepsy. Things like lemon balm, chamomile, calma, and all that. You place the child on it, and then his seizures will go. Reduce flesh and sugar intake in this body. First and foremost, that's the starting point.
Okay.
And then you see the boy begin to get better.
We have so many text messages coming in. And doctor, I just wanted to quickly look at some of this. Hello, doctor, please, what can I do? I don't eat much food at all, and I need to work on my skin. Which of the fruits do I need to take? Please, I need your help. David Adebayo.
Just do fruits, but don't do sweet ones. Any other fruit that's not sweet, and then these vegetable juices we're talking about, start taking them, your skin will begin to glow.
That's beautiful. Hello?
Hello, ma.
Thank you, sir, for calling. Please go ahead, sir. Your name and where you're calling from.
My name is Mrs. Ojo from Ibadan.
All right, ma. Please go ahead, ma.
Please, ma. When they say there's shortage of blood, we squeeze ugu leaf. Now, they will say we should put small milk so that the blood will increase.
No, Mommy, you don't need that. Just the leaf alone, you do the leaf, maybe a glass daily, it's okay. You don't need to add the milk and the malt that people usually say. Okay? You don't need it.
Thank you very much.
Thank you.
Thank you, ma. Amen.
God bless you, Mom.
Thank you, ma. Yes, ma. I just
that's what people always say.
Yes.
That if you are...
There's even a saying on it, but don't worry. Let's just keep it for another day.
If you do that, your blood... And then no matter how you do it, it takes about 3 months for blood to be replaced. Okay, so it takes about 3 months. You just keep doing it. You keep doing it.
I hope it's not too much when you take too excess of it.
No. These vegetables are things you can take on a daily basis.
And also can give to children
my suggestion is don't take a particular one alone. If you take cucumber today, you can take carrot tomorrow, you can take beetroot tomorrow, because they all contain certain things, and then they also have their diversities. Okay, so you can get the best from all of them.
Okay, so you can take ugu leaf, blend it with carrots, and take it for today. Then maybe tomorrow you take avocado.
Combine beetroot with something else.
Okay, beetroot. Yes. Okay. Oh, that's good.
Little quantities, you blend them, you drink them.
Okay. Hello, doctor. I'm watching this program live from Minna, Niger State. My question is, what quantity of the vegetable mentioned can I blend together? My name is Mrs. Alabi.
If you take, for instance, 2 pieces of carrot, you cut them, and then you take your cucumber, maybe half of it or a third of it, and then you blend them, add water. That's all. That's what we are saying. And then you blend them and you drink them. That will serve your body better than eating 10 carrots and a whole or 2 whole cucumbers.
Okay. Yes. I think the blending one is better. I will also advise that. Hello, doctor. Our vaginal smells sometimes, and our urine. I feel itching sometimes, and I have treated infection, both English and locally. Please, what can I do? I need your help.
Maybe there has been continuous reinfection. Next time you treat, let your husband be treated alongside at the same time. And then you need to work on your body so that your immunity will go up. Obviously, also, your immunity is down one way or the other. We need to, number one, rule out the presence of any generalized diseases that may be bringing down your immunity. And then by the time you're on things like garlic, ginger, echinacea, tea, your immunity will be shot up.
Hello, Dr. Chris. I'm a regular fan of yours on TV show every Monday between 6 to 7 p.m. My question is, how do I manage a child that has breathing problem? Okay, manage a child having breathing problem. It comes once in a while. The last time we took him to hospital and they normalize him by giving him some drugs. But does it have security, or does it secure his health?
What you are describing looks like the boy is on the verge of developing asthma. So you need to do something more that will control it more than just rushing to the hospital every time. Reduce animal protein from this boy drastically. You may not eliminate, but reduce drastically. Remove sweet things from his food. Give him the vegetables we keep talking about. And then that boy is already doing well as I'm talking right now. Okay.
All right. Hello, doctor. My 7-year-old girl always complains of stomach pains, and we've gone for checkup with scans and series of tests. But doctor says nothing is wrong with her. Please, what can be done?
How many years old?
7. She's 7, and she complains of stomach.
I'll need to talk with the person after.
Okay, please, let's have Dr. Chris Williams' numbers display right there. After the program, you can get to call him. And the mother of this child, Dr. Chris, would like to speak with you in person. Thank you. Hello? Hello? All right, we lost that call. Might be due to network, but please do call us back. We'll be glad to have you. Okay, can we preserve juice in the refrigerator?
Not more than 24 hours.
Not more than 24 hours. Okay, can the children take vegetables?
Oh, yes.
I asked. Okay. Wow. Which of these fruits is best for pregnant women?
Vegetables, not fruits. Vegetables. Vegetables. The ones we talked about, cucumber, cabbage, carrot, there's no one there that's poisonous for a pregnant woman. If she can eat it, then she can blend them and drink them. Yes.
All right. Hello, doctor. Please, I put to bed 3 weeks ago, and I started exclusive breastfeeding a few days after. But for this day now, I've been having pepperish feelings in my left breast, and I find it seriously painful to feed the baby on that breast. Please, what can I do?
There's an infection in that nipple.
Okay.
But I would like you to see your doctor. Then they will prescribe an antibiotic or the other for you. There's an infection.
Okay. Then sometimes I usually notice that, when you're breastfeeding the baby, maybe it takes some time before the breast milk comes out. There's a pill on the nipple.
Yeah, because the child will be using force and all that.
And sometimes my mom will tell me that is the child mouth will heal the breast. After some few days, it will heal, but it will be very painful. But just like Dr. Chris said, see a doctor, which is very, very important. Thank you. Hello? Hello? You took time before you could respond to us. Please don't listen to your television. Kindly call us and mute your volume. Thank you. Hello? Hello?
Hello?
Yes, ma, we can hear you, ma.
Yeah, good morning. Hello?
All right, we can hear you quite well, but you're trying to listen to me from the television. Please just mute it or reduce it. We can hear you loud and clear. Thank you. Hello?
Hello?
Yes, go ahead, ma'am. Yes, hello, I can hear you.
All right, good morning, ma'am.
Thank you.
Good morning, sir.
Good morning, ma'am. Bless you.
Yes, sir. Sir, thank you so much for this topic. It's very, very interesting. I've been trying to get hold of you, but people have been busy. Please, I just need to ask a quick question. You mentioned the lemon water to take. I have hypertension, high blood pressure, and my mom also suffers from diabetes, so I don't know if it is safe.
Yes, it is. It is.
Okay, sir. Okay, sir. Another question, sir. What about, you mentioned life drop water. I don't know, where can we get that? I heard you say life drop water.
Check any pharmacist, you get it. Life drops.
Okay, in the pharmacy, sir.
Yes.
All right, thank you so much. God bless you. And I also said we welcome your text messages too. Please feel free to send us text. Okay, when you talk about combining fruits, do you mean extracting the juice because some of the fruits mentioned cannot be blended easily? Kindly shed more light, sir.
Read that question again.
When you talked about combining fruits, do you mean extracting the juice?
I mean blending. You can blend, you can juice. There's no one here that cannot be blended. Carrot can be blended.
Yes.
You just need to get a good blender. A good blender. It can be blended.
And
it can be blended.
You can get the water out of it.
The beetroot can be blended. Just slice them small, and then you blend them.
Slice them little. That's where you can get the best.
You blend them.
Thank you so much. Okay. Okay. Please, doctor, what's the cause of mouth odor? What can I do?
If it's not coming from your mouth cavity, then it's coming from inside. And for most people, they have done everything about their oral cavity, and the thing is not going, then it's coming from inside. Your intestines are sickly. They are not clean, let's put it that way. So you need to change the configuration of your intestines. Change your diet. First and foremost, reduce or remove totally animal proteins. Or if at the most, reduce very drastically to a very drastic amount your intake of animal protein. Stay away from eating sweet things. By doing these two alone, you begin to see that the odor begins to come down. And then by the time you are on a probiotic, and then you are taking blended vegetables, and then you detoxify and alkalize your body, that body odor will be gone. Yes.
All right, thank you for this program, the presenter and also the doctor. Please, what can I take naturally to increase infertility and libido?
To increase fertility and libido. Several things. You can take Tribulus terrestris, you can take maca. If you are grappling with hormonal imbalance, you can take chasteberry. There's damiana, you can take it. Donkwa, you can take. There are several herbs that can help to increase your libido and fertility.
All right. I've treated malaria for the past 3 weeks, but still having symptoms of fever and weakness every morning. Could it be low oxygen?
Well, it could be, but we will not be able to say from here. So I will advise that you make sure maybe you say, doctor, let them give you adequate treatment for malaria. Many times when people say they keep having malaria, sometimes it's inadequately treated malaria. Okay, treat it very well, and then it may be an infection. Having done all that, then we'll be able to say maybe you are grappling with low oxygen or not.
Can hepatitis B patient take the ugu water?
Why not? Yes.
Okay, yes. Okay. Let's just pick this as our last caller. Hello? Hello?
Hello, good morning. Yeah, good morning.
Yes, can you mute the volume on your TV set?
Am I on to healthy living?
Yes, you're on to healthy living.
Okay, I've been calling and it's been quite hard. So I have loads and loads of questions to ask. Please, I hope you give me the time.
Please, ma, we don't have much time. That's why I said you should reduce the volume on your TV set. We have less than 4 minutes, please.
Okay, all right. Since I wanted to ask about asthma and adenotonsil, I've seen something like that as a treatment. Please, I've been having this, and there's I don't know what to call it. I noticed it like 4 years ago on the left breast, but it's very little, like a very little, I don't know, it's not a lump, but it's inside. It's not that painful. I've been to the hospital, done a scan, and they said they wanted to remove it, but my husband said no, let's be praying about it. So I've gone to my pastor, he said we should just remove it, but I don't know, he has that faith. Me too, I have the faith, but I want to get an opinion from a doctor, at least from Dr. Chris. What can I do? It's not that painful, but most times, sometimes I'll feel like there's this strange feeling coming from there.
Okay.
Then it will stop.
Okay, ma. Thank you, ma. I think,
yes, I think along with your faith, you should see a doctor, and if a doctor tells you to remove it, go ahead and remove it. Go ahead and remove it.
Just to play safe. Yeah. Be on a safe side when your doctor is. And if you feel where you don't have full confidence in that doctor, you can get to call Dr. Chris. Let him see.
Or even get another doctor
to see
a qualified doctor. Yes.
To look at it.
But removing it does not negate your faith, actually. It's part of faith.
Okay. Right. I have a text. My 8-year-old daughter always have frequent bacterial infection in her lungs and stomach. Please, how do I stop this? Thank you.
That child is too acidic.
Okay.
Reduces his or her acidity. Alkalize the child. And then that immunity will go up. Yes.
Alkalize the child so that the child will have a good
immunity. Yes.
All right, doctor, thank you so much for coming on this program. It's good to have you. And whenever you're around, we're always blessed. I want to say thank you to our viewers also for being part of Healthy Living on Dove Television. We want to say this is where we want to pull the curtain. We'll sign off with a prayer coming from Dr. Chris Williams.
Lord God, we are grateful for today. Thank you for the episode we just had. We join our faith with your people, and we declare that the battle against disease is already won.
Amen.
In the name of Jesus.
Amen.
Thank you, Father.
Thank you, Lord.
In Jesus' name.
Amen. Thank you once again,
Thank
Dr.
you.
Chris Williams, always talking about the natural way to go when it comes to your health. A big thank you to everyone who was putting one effort or the other in Dove Television to make this program come alive. We want to say thank you. We're grateful. And a big thank you also to our viewers watching us, sending in your text messages. We have lots of it here, but we're so sorry our time is fast spent. But not to worry, we'll come again in our next edition, an interesting and exciting edition of Healthy Living on Dove Television. My name is Oluwafemi Odunto. Have a fantastic day full of sickness-free, yes, and God bless you.